Well, good afternoon to you, wherever you are in the country. It could be early evening or maybe even in the evening in Europe, but welcome. My name is Scott Fontenot, and I direct a foundation for those who have central pain syndrome. Excuse me. And so for the next hour or so, we'll be talking about that subject and talking with each other. I believe that you can interact by texting, and I'll try to recognize that you are there and texting. I'll be going over some specific things in this, our second try at doing a monthly time. First, let me explain. For about 10 years now, I've been part of this Facebook group, which also has a foundation that sponsors it, helping with all kinds of efforts. And we're going to start by talking once a month with each other, talking about central pain syndrome and some of the aspects of it together. That leaves a recording that folks can keep an eye on, and they can follow and see what's happening. But let me just share a few things with you as we get ready to talk about the survey. We're doing a live stream, which is me talking for a little while, and we're recording this. But if you happen to be watching, we've invited a number of people to come and join in. If you happen to be watching, you can ask questions. I hope in the future to know how to patch people in so that we actually show your voice and mine talking together, but we're still learning how to do those things. But a monthly live stream, we're trying to have it the third Friday of each month at a specific time, which we're kind of settling on 5 o'clock in the Eastern time, a little bit before supper, dinner time. We tried 6 o'clock, and that'll be the third Friday almost every month. So that's what we're trying to do. Just talk together and see if this is helpful in learning more about central pain syndrome. I haven't been talking much today, so I realize now that even my voice is a little bit tired, but I'm sure you'll hang in there with me. It's been a difficult few days. I also wanted to mention that I feel much like most of you do. I suffer from central pain syndrome. I had a stroke and brain surgery 11 years ago now that left me feeling all the same things that most of you feel with the burning pain and that sort of thing. Today and the last few days have been a difficult time, but it's the day we scheduled, and so we're going to go ahead and talk. And so it's a good time to do that. And so there's two things that I want to talk about before we get into the survey, our annual survey. One is that the new survey for 2021 will be posted today or tomorrow. And we would ask everyone who has already taken the survey if you would please take the survey again. So we had about 180 people the first year take the survey. Then we just had about 80 people the last year take the survey. And so we've had about over 200 people take the survey. But it helps because we're trying to see from year to year if anything is changing. So we ask everyone who has already taken the survey if they would take it again. And then all of those who are new, if you would also consider taking the survey. And that's what we'd like, for everyone to take the survey. So we're hoping this year, instead of just 180 or 80 as we had the last 2 years, that will actually have closer to 200 to 300 people taking the survey, and that will help us to have a better idea of what's happening with folks who have central pain syndrome. And so that's the first thing that's important. The second thing, we're going to be doing our first preclinical test. And so there are various kinds of tests that happen, research that happens involving different products or different medicines. And so we're going to be working with a company that I happen to know the president very well, and he's been selling bracelets that have the same rhythm as the Earth's rhythm. And by wearing these bracelets, a number of people, especially involved with veterinary medicine, interestingly enough, he works at horse shows and dog shows, and they started by using these, they're actually programmed minerals, and so they help the body to get in line with the Earth's rhythm, and there's a special rhythm to it. Anyway, we're going to be trying to have 10 of us wear those bracelets for a period of time, 1 month to 3 months, and then we're going to try and see if it helps anyone who has neuropathic pain. So it's a little bit different. but it's something that's easy. You just wear a bracelet for a month and every day write down if you had any benefit from that. And we're going to be doing that with a number of tests as we go along, but this is sort of an easy way to begin with a test that involves a bracelet. So soon you'll see me say, hey, if you're interested in this, then let me know, and I'll post that on the group, and then we'll go from there. So great. Well, I can see that we have a number of people who have tuned in. Linda and Steve. Stephen Kelly is watching, Anissa. And I just want to thank you for tuning in. That helps me to know that I'm talking to some friends. And those are a couple of things I wanted to let you know, that we're going to have a new survey out in the next day or two, and we really encourage you to take it. We're going to do our first test, our first preclinical test, where we as a group test something to see if it helps us with neuropathic pain. And that'll be these bands that we wear around our wrists and our ankles. So keep an eye open for that. There'll be things in the future where we say, here's another test that's going on, and perhaps you'd like to be involved in this, and just keep your eyes open. So what I want to do today, this is the second 1 hour time that we've had to talk. The last time we talked about what CPS is, central pain syndrome, and a little bit about who has it. But what I want to go into during the second hour that we have, and anytime you have a question or a comment, go ahead and type it in, and I will try to include it in our discussion. But over the past 2 years, we've done something that I have felt is very important, and that is ask as many as we could, about 50 important questions. And the first time we did this survey, which was in 2019, the survey was actually put together by a young man in Eastern Europe who is a medical student, and he did this as his as what he did for his degree. And so he put this survey together, and then we've been able to use it to find out about people who have central pain syndrome. I think in the future we'll find that the survey year by year will show what's changing, what's staying the same, and many things like that. And so we're going to talk about what we've learned by taking the survey over these last 2 years. So let's just jump right into it. We've got just about an hour, less than an hour to go, but let's talk about it. The first thing that you'll notice when you look at it, and I would say if you go to the files on the group, you'll find that these surveys are available in a downloadable form. So it's a PDF that you can download from Facebook. They'll be up on the website too as well. But if you wanted to, you could actually download that and follow through. But the first question we asked is, what is your gender? And it's interesting because on Facebook, in our group of about 1,400 people, we found that about 70% are female and about 30% are male. And the reason that's important as far as a survey goes, or as far as research, in real life, where CPS strikes real people, it's about a 50-50 breakdown. So half the people that get CPS are men, and half the people that get CPS are women. But in our Facebook group, just because that's how Facebook is, it's a little bit older and a little bit more female than male. And so in our determining how these percentages break down, we have to use algorithms to adjust, because we have less men in the survey than in real life, and we have more women. And so we'll actually be working on using algorithms to make the 70% down to 50%, and then the 30% of men up to 50%, because in real life, the fact is that half as many men as women get afflicted with central pain syndrome. It's 50-50. But in our survey, it's 70% women and 30% men, which shows that on Facebook, there's a little bit of a disparity there. The second thing we looked at, and I'm looking at actually the survey itself, which, as I said, you can download and look at the very same thing as I am. But what are the ages of folks who are part of the group online, but then also took the survey? And the interesting thing that we find is that most of us are in the 35 to 60 year age frame. What's interesting about this to me is that half of those who have central pain syndrome are stroke victims, about half of us. About 25% and we'll get into this more, are spinal cord injury folks. But since half of us are stroke victims, we look at stroke statistics to correlate between those who have central pain syndrome and those who have who have had some sort of stroke. And what the interesting thing is that 75% of strokes happen to people who are over 65 years of age. 75% of all the strokes that happen to people who are older. They're over 65. But people who survive and have central pain syndrome tend to be much younger. In fact, what we find is that the average age of the first stroke for people who survive and have central pain syndrome is about 41 years of age. And so we're kind of a young stroke survivor group, in a sense. We're kind of a young spinal cord injury survivor group. Then there are other groups of people, and we'll get into this, who have Parkinson's and muscular sclerosis and other similar things that cause CPS. But we are a younger group than most folks who have strokes. We're a young stroke group. And I find it interesting. I've been trying to talk to more younger folks because in the future, they will make up a larger chunk of who we are. But 13% are 35 to 44 years of age, 22% are 45 to 64 years of age, and then 55 to 64, that's 40% of those who took the surveys. And so what we begin to see is that we're sort of a middle-aged group compared to where most of the strokes occur. So 25% of the strokes occur in people under 65, and that's us. That's who we are. When we asked about race, we find that those who actually answered the survey, 90% are Caucasian. And we also find when we then begin to look at where they live, that, and this is very interesting, 87% of the people who answered the survey and therefore belong to the Facebook group are in the United States of America. And the reason that's important, I've been working very hard on global statistics, and I can give you some of those, even though it makes some people a little bit down, because we find that there are probably just under 20 million people around the world who are suffering as we do with central pain syndrome. Just under 2 million of those live in the United States. But what's interesting is on Facebook, it's about 87% of those on Facebook. So 1,400 people out of 20 million, or 2 million in the US, who have CPS are this small Facebook group. I keep emphasizing that because if we do care about this, and if we want to do something about it, we have to realize we're just sort of this small kernel, and we don't represent the world. Because, for example, there are probably 6 million people in India who have central pain syndrome, probably equally nearly 6 million people in China who suffer from central pain syndrome, and that compares with just under 2 million, or about 2 million if we include Canada. And so that's where we sit. But what's interesting about the group is we're about 90% North America, and the Facebook group and the survey is about 10% or about 9% in Europe. And so of all the people in the world who have CPS in our Facebook group, we are mostly Americans and then Europeans. Then what part of the U.S. do you live in? That breaks down pretty much the same as demographics. And so there's New England, which is 7%, Middle Atlantic, which is New York, New Jersey, Pennsylvania, 11%. And then we just go right through North Central, West North Central. Interestingly, there are about 22% in the Pacific area, which would be the West Coast. And so that's where people are. Very important statistic to me was the seventh question. Do you currently receive Medicare or government disability benefits? Because what happens when we begin to talk to other folks about our central pain syndrome, we realize that there are those who seem to be strongly affected by it. They're disabled. They're not able to function enough to be able to work and so on, and so they're disabled. Then others, maybe they would wish they could receive some sort of benefit, but they don't, or they're able to continue working. So what we find is just under 60%, which is interesting. 2 out of 3 people who answered our survey are on some kind of government benefits, whether that would be Medicare or it could be health insurance, Medicaid, something like that. But 2 out of 3 of us, and then 1 out of 3 are not. What that also tells us, though, is that this is a very serious thing that happens, a very difficult disease. And so we want to make sure that the government understands that it's something that is a disability. So one thing I'm finding is that, for example, trying to get the right medicine for central pain syndrome is difficult just because they don't understand exactly what it's all about. And so, but 2 out of 3 of us are on Medicare or some kind of benefit. And I wanted to make that clear. It's an interesting statistic to me. Have you been diagnosed? We asked folks, and a number of them had not been, and so they didn't continue with the survey. But here's an interesting question. After you noticed the pain, how long before you were diagnosed with CPS? One thing that we would like to do as a foundation is decrease the amount of time it takes between the time that a person says, hey, I have this bad feeling in part of my body. I have a burning feeling in my arm or along the right side of my body. I had a stroke, or I had spinal surgery, and now I have this pain. I can't explain it. We want to reduce the time between the time that a person realizes that they have this bad pain and what it is, central pain syndrome. And that depends a lot on how much their doctor knows, how much they're able to search online and find us, and those sorts of things. But in the survey, what we found from about 250 people is interesting. They immediately knew after they noticed the pain that they had CPS. That was about 12%, 12 out of 100, about 30% within 6 months. So about 42% of the people who had pain and then found out that it was CPS, almost half of us knew within 6 months that they had central pain syndrome. The interesting thing about this is between 2019, the first survey that we had, and 2020, which is our second survey, that time has actually shrunk. So people are finding out faster after just a year of effort or a year of keeping track. People are finding out faster that they do have CPS, which I find very interesting. It took about 26% of the people, though, 1/4 of us, between 1 to 3 years. So about half of us learned before a year went by that we had CPS, but then another 1/4 of us, 1 out of 4, it took a bit longer, something like 1 to 3 years. So the first year we had this burning, we didn't know, but sometimes between a year and 3 years, 1/4 of us found out. About 10%, 1 in 10, it took 3 to 5 years, 6%, 5 to 10, and 3% over 10 years. What that represents also is the fact that 10 years ago, when I discovered that I had CPS, there was much less knowledge about it, both amongst medical professionals, amongst physicians and doctors, and amongst those of us who have central pain syndrome. And so what's happening is that more people are knowing about it. And so the time that it takes to know that you have CPS is falling, and that's a good thing. Now, we asked the next question, what's the cause of your central pain syndrome? And this is a very important question. It's something that we already knew, but as we ask people, we find out. And what it does is it actually confirms some of the more in-depth surveys and some of the clinical research that has been done. So, what is the cause of your CPS? First of all, strokes caused 54%. So 55, a little over half the people who have central pain syndrome, it was caused by a stroke. Okay. Secondly, spinal cord injury was about 20%. So 1 out of 5, or the second largest group, would be spinal cord injury. And so something happened. It could be anything from an inflammation to a surgery that went wrong, but something going wrong with the spinal cord causes central pain syndrome in about 1 out of 5 of us. Then we had MS, which was about 1%. Parkinson's, 1 out of 100. The number is probably a little bit higher, but we know that about 30% of Parkinson's, 30% of MS patients have CPS. Many of them are not aware of that. And then we have infections. So people have people have encephalitis, for example, with swollenness and inflammation, and that causes them to have central pain syndrome. And then we had about 1 out of 10, 8% say that it was brain or brainstem injury other than stroke. So that could be some kind of traumatic injury outside of the head, like an explosion or just something that really causes damage to the brain, some kind of traumatic brain injury, which we're finding is a larger number of people. Steve Obremski has checked in, and we're finding that there are different things, many different things that cause CPS. Stroke is half. Another 20 to 25% would be spinal cord injury. Interestingly enough, about 20%, 1 out of 5 listed others. But when we looked at the reasons that they gave when they said that there was some other reason that they had central pain syndrome, we found that many of those were brain injuries, many of those were strokes, and many of those were also spinal injuries. Now, we have a little bit of time talking together. I'm trying to relax and be myself, and I'm losing my voice. So I'm going to have to take a drink. If you'll just excuse me, I have a little bit of kombucha here, I think it's called, and I'm going to take just a quick sip of this so that I can clear my throat. Thank you. That feels good. And we're going to continue talking about the survey. Now, the next thing on the survey is, where was your nervous system damaged? So we know that people had strokes. We know they had spinal injury, but we were trying to find out where. And we found out, again, 50% was in the brain. So we know that with central pain syndrome, it was called thalamic syndrome for a long time, because in the thalamus on the left side of the brain, in the parietal area, damage to that area, which is actually, we know now, a network, not a zone or a spot on the brain, but there's actually a network between the brain stem and the cortex here. There's a network of thinking that is the network that's violated. So there's damage somewhere, it violates that network, and then instead of normal sensation coming to the brain and being processed correctly, what we find is that it comes to the brain, it's processed as pain. And so where does that happen? Half the time, if someone has central pain syndrome, it's because there's damage to their brain. The second place would be the spinal cord. So just like they had stroke and spinal cord injury, it's fairly straightforward. It's the brain. And then about 22% said it was the spinal cord. Brainstem is about 15%. So 15 out of 100 would say, I had injury to my brainstem. Usually this is a stroke. A lot of times, most of the time, it involves the arteries that run along the side of the neck. And unfortunately, one way or the other, they're blocked. And that blockage causes a stroke, often in the brainstem. The brainstem is one of the hardest places in medicine to deal with, because it handles so many of the subconscious processes of the body, things like temperature and thirst and arousal, all these sorts of things that are below the conscious level, they're subconscious, are handled by the brainstem. And so people feel like they're hot, they feel like they're cold. There's all sorts of malfunctioning that goes along with central pain syndrome when the brainstem is injured. Then we had 12% say the nervous system, which means somewhere, it may not be the brain exactly, or the brainstem or spinal cord. It's one of those places. But here's an interesting thing that I wanted to talk about with things like fibromyalgia and other things that are degenerative causes of central pain syndrome. From the main nerves, so here's your spinal cord, this little spinal cord going up and down in your back, and there are large nerves that connect to it. And these large nerves, sometimes the problem is the peripheral injury to the nerve. It's not central pain syndrome. What's happening now, we're finding, is that as these large nerves are inflamed and other things happen to them, whatever the cause is, where they connect to the spinal cord, then something that's a peripheral nerve injury, which could be degenerative most often, it turns into central pain syndrome because the inflammation then gets to the spinal cord or the brain stem. Usually it's the spinal cord. And so we're seeing that a lot of our nervous system injuries, actually big nerves that are inflamed, and they're coming to the spinal cord. Okay, the next question is, did you learn about central pain syndrome? And so this is a very important question. we find that about 55%, or a little more than half of us, learned about central pain syndrome from a medical professional. So one thing we're trying to do is educate medical professionals, neurologists and primary care doctors, nurse practitioners, and others. We're trying to educate them that what central pain syndrome is and when to look for it in a person who might have had a stroke, or they might have had spinal cord injury especially. They might have Parkinson's, they might have MS, they might have some of the other prime causes like encephalitis. Steve is mentioning that his hands and feet are cold, but his body feels warm. He's had encephalitis and he's had inflammation of his entire nervous system, but his brain. And so we have these sorts of symptoms. But the question is, who told us about CPS? And half of us learn that way. About 30% of us, 1 out of 3, are learning from an internet search. So half of us are learning by talking to a doctor or a nurse practitioner, but about 30% of us are learning by searching on the internet. The interesting thing about this number is that in 2019, the first time we took the survey, a few more people were finding out that about central pain syndrome from medical professionals, in the first survey, a few more people were finding out by searching online, and a few less people were finding out from medical professionals. What this tells us is that more medical professionals are themselves doing the search online, and more medical professionals are themselves learning about central pain syndrome. Some of the projects we're working on very strongly are finding out which medical professionals know and placing them on a map, because the biggest question we get is, in my area, in my city, is there a doctor that knows about central pain syndrome? And there are, but we don't know who they are. And we're trying to put that into a place where you could go to our website and you would see on a map where the doctors are in our city or region. We're working on that. But it's good news, in fact, that doctors are where half of us are learning that we have central pain syndrome. It means that our neurologists and our doctors are doing a good job on this. I'm trying to look at the clock here to find out how we're doing on time, not seeing it. So we're just going to keep on going. What part of your body does CPS affect the most? This is another very important question that I found. It affects the head and the brain only 2% of the time. The entire right side of the body, 28% of the time, is affected, or the entire left side of the body, another 24% of the time. So what's interesting about this is about half of us, about 50%, are affected either completely on the right side of our body or completely on the left side of our body. That's because half of us have strokes, and when we have a stroke, it affects the opposite side. So I had a stroke. You can see my scar right here from brain surgery, but I had a stroke on the left-hand side, and the right-hand side of my body is the bad part. And so half of us have trouble with the entire right or left side of our bodies. Many of us have problems with our right leg and foot. And so quite often it's our lower extremities, especially the leg from the hip down, that burns with people. That's because with spinal injuries that cause central pain syndrome, generally the injury doesn't happen above where the spine is injured, but the injury happens below where the spine is injured. So if you have a spinal injury here, then the burning will happen below. It won't happen above generally, it'll happen below. And so left leg and foot, right leg and foot, and then about 20% say they're having central pain type feelings over their entire body. And I keep using some as an example, but I know that some who have had, for example, encephalitis, they end up having pain in their extremities, all their hands and feet, right and left, or all their arms and legs, and that tends to happen. Next question. What seems to trigger an episode? And so we talk about where they have it, right side or all the left side, what triggers it. We find that, first of all, and I found this very interesting, more people are triggered by stress than any other thing. 82% of us, 8 out of 10, said that stress triggers it. The next most important trigger was exertion or getting tired. And so we get stressed and we get tired, and our burning gets worse, we found. The next thing was motion. 6 out of 10, when they move, it's called motion allodynia. So 6 out of 10 people with central pain syndrome had more pain when they were moving. Next, we find that things like the weather are changes in barometric pressure, and then also heat. So when people feel like they're warm, about 1/3 of them felt like that was triggering an episode. And so people have flare ups. The pain is going along just at its normal sort of lower level, but then it goes to a higher level. And we find that weather or stress or getting tired or moving too much, all these things can cause that. Some people find that getting wet, about 1 out of 5 find that water hitting their skin can cause central pain syndrome to get worse. And then there was 1 out of 4 listed various other things. Yes, Steve said stress, definitely, and I agree. So what's interesting is that heat or water or stress or something touching our skin, about, 2/3 of us found that allodynia or something just touching the skin caused central pain syndrome. And I think that's a well-known fact. And so all these things are quite interesting. So we're halfway done with our time, and we're halfway done with our questions. If you have a question, type it in. But what I'm doing is looking at our survey where we asked about 50 questions, and I'm going through that. With a scale of 1 to 10 being the lowest and 10 being the highest, what's your pain level today? And the average pain level was about 5 or 6, which is interesting. About 30% said their pain was 8, but about another 34% said their pain was 6 or 7. And so right in the middle, 6 to 8. 8 is high, 9 and 10 would be the highest, 1 through 8 would be lower, but only a small percentage, I would say 4, 6, about 15% put their average pain under 5. Between 5 and 8 is where most of us, about 60%, say that our pain is. In recent weeks and months, what was your pain? And again, it comes out about the same. About 60% of us, our pain was between 6 and about 8. And so upper to upper high is where we say that our pain levels are on an average. What's the strongest pain that you've experienced? Well, of course, 60% of us said 10. I tried to be very careful using the pain scale, and we're trying to devise a pain scale that works very well for central pain syndrome. But I try to never say that my pain is a 10. Last year, I cut the 2 fingers on my hand. I don't have feeling in these fingers. I can move them, but I severed the nerves and the tendons. I was cutting some bushes, and I dropped a hedge trimmer on there. And it caused a lot of damage. I had 22 stitches, and I had surgery. I'm having physical therapy and all that sort of thing. But my point is, how do we experience pain, and when do we have the highest pain? When that hedge trimmer hit my fingers, that was a 10. And so I seldom call central pain syndrome a 10. I call it an 8 when it's at its worst, as it was the last couple of days. But generally it's between 5 and 7. On a very good day, it's about a 2 or a 3, maybe a 4. And that means I can function okay. Now, what level has your CPS sensation changed from the initial pain as you remember it? Some say, about 1 in 3 of us say that their pain has changed a great deal. About 20% say it's changed a lot. And about 1 out of 3 say a moderate amount. About 12% say a little. So a lot of us have had the pain change. And I think what happens is the pain's gone up. What's the cause when it's the shoulders down? I've had occasions where it's been in my lips and throat. What causes it to travel from place to place during a flare? Those are Linda Hamilton's questions. Let me just talk about them a minute. I want to be interactive, and I appreciate your question, Linda, because we are trying to talk. And eventually I hope I could just have you come on and talk, and then we discuss this. But I'm not sure about shoulders down. I do know that on the right side of my body, I feel the pain from the top of my head all the way down to my toes. That's because it's in my brain. I would say from the shoulders down, I don't know if your injury is brain caused or spinal, but generally it's because it's spinal. When it is up here, though, in the lips and throat, there's trigeminal neuralgia. There's only one big nerve which comes from the spine up into the head, the trigeminal nerve. It comes right here to the front of the ear, and it spreads throughout the head. So when we have burning on anywhere in our head, the side of our head, in our mouth, in our teeth, in our gums, when we have burning, It's from this big nerve on the side of our head, and it's called trigeminal neuralgia. And so when we flare, I found that it can happen in different places. So for me, for example, in my ribs, I have very strong pain, like I've been kicked in the ribs, and I can't explain it exactly, but the pain will feel as if the pain is in different parts of our body. Yes, we're both cavernoma. Linda, I remember that we're both cavernoma. And so I think explaining why certain parts feel worse than others is almost impossible. Some of us have suggested that maybe where we had really bad pain before, it's like memory pain. I was kicked in the side by a horse, but I'm almost sure it kicked me on this side and not the side that hurts. But those are good questions. Why would we have it from here down? Why would we feel it in our face? And I think it's just all the nervous system. We asked this question: describe the depth and location of the pain in your body. About 20%, 1 in 5 said it was just superficial. About 34% said it was external. 1 out of 3, though, said it was under their skin. So this can be more than 100% because some of us feel it not only on our skin, but we feel it externally. Then we feel it under our skin. What I found very interesting was 79% of us said that we found central pain syndrome deep, which means we feel that it's in us. I once asked a doctor, is it actually inside of me? My heart, my stomach, and they couldn't answer that. They know that the nerves that are on the outside are causing bad central pain syndrome things, but we don't know. And yet 8 out of 10 of us felt this pain that was deep. 54% said it spreads or it's diffuse. I think that helps to answer Linda's question. Why do we feel it change? Because it's diffuse. It feels like it spreads through us, or it's in one part and not another. It radiates. We feel like 6 out of 10 feels like it radiates. It starts maybe in one place and spreads to another place. And so these are all the things that we experience. How many years have you been living with central pain syndrome? So we just talked about where we feel we have it. We feel it deep. We feel it superficially. It's very interesting. We feel it from the skin to deep inside. But how many years have we known about it? These are all questions that doctors, we hope, will begin to look at, and researchers, because they're very important. But about 1 to 3 years, 30% of us knew within the last 3 years. About 30% of us knew within the last 7 years that we had CPS. And then beyond 7 years, it's just about 20% of us. 10% of us have known for 20 to 30 years. That means people have known they had CPS for 2 to 3 decades, if you can imagine. I've known for 1 decade. When I talk to people, and I could name some names out of memory, but we have a few people who have known now for 2 or 3 decades, 20 or 30 years, they've lived with central pain syndrome. I think we will be interviewing 1 or 2 of them if we can have them, because they've been living with this pain for a long time. I think the reason that the number that a lot of us have found out, let's see, if I added up 45, about 60% of us have found out in the last 5 years, is because we found out and we decided to join the Facebook group. And so the number of people that have known longer is small. Most of us found out recently, and we're just learning and then joining the group to find out more. Is your pain constant? The answer is 25% yes. Is your pain always there? A consistent pain that sometimes gets better and sometimes gets worse? The interesting thing was that 2/3 of us, or 67%, said yes, we have a constant pain, but sometimes the pain gets better and sometimes the pain gets worse. And again, looking at Linda's question, why does it feel like it hurts more in different places at different times? I think the answer is simple. I think that what happens is sometimes it feels like we have more and sometimes it feels like we have less. And therefore, we feel like it's more or less in different parts of our body. But that's an interesting question. Is your pain constant? Only about 1/4 of us feel like it never changes, but 2/3 feel like it changes quite often. It's consistent, though. It's always there. The next question, 22. When you have flare-ups, how long do they last? About 1/3 said the flare-up lasts for a day, 24 hours or longer. about, let's see, 28% of us said that it lasts 1 to 3 days. So about 1/3 of us said it lasts 24 hours. Then about 2/3 of us said that the pain when it comes to the flare up lasts for about 3 days or 72 hours. About 15% said it lasts a week. And then just a small number, about 10%, 1 out of 10, said they get a flare and the flare lasts for more than a week. So just summing that up, about 1/3 of us says a flare happens 24 hours. But then a good amount of us, about 35 or 40%, say that a flare lasts up to 3 days. So right around 24 hours to 72 hours is how long the pain lasts, and then it tends to go down. Again, if you have any questions, type them in. What I'm doing is going through with the questions we have on the survey, and I'm just going through and putting it on record in video form, what the records show. How often do you have flare-ups? 14% said they have flare-ups every day. 23% said they have flare-ups, several times a day was 14%, but daily was about 1 out of 4. Then 35% of us, 1 out of 3, say they have these flare-ups of the pain about weekly. And so, you put that all together, and about 2/3 of us have flare-ups anywhere from several times a day to once a day to weekly. So here we are, most of us are having these flare-ups. 1/3 of us then will be having them just monthly or less. So that's interesting, but I think most of us have flare-ups quite a bit. When are your flare-ups most likely to occur, we asked. Early morning was 11%. Morning was about 9% more. Midday, 6%. But the interesting thing here was from midday to evening, which is about, 20, 30, about 40, about half of us are most likely to have a flare-up of our pain between midday, about noon, and into the evening. What I found interesting about this is that about half of us are stroke survivors, and stroke survivors tend to have difficulties during the same time, about midday to early evening. Sometimes it's called sundowners, but we tend to go through cycles where our body does bad things. And so what we're finding is we have pain flare-ups during this time of the day. Midday to early evening is in most of us. Now we're talking about drug treatments. First we asked, what kind of drug treatments are you aware of? And the interesting thing was most of us knew about anticonvulsants. That would be gabapentin and Lyrica. These are drugs that were designed to use against epilepsy, which is having convulsions. And so the drugs were designed to stop convulsions. What we found, though, is that for some reason they help with neuropathic pain. So people who have diabetes and people who have central pain syndrome and a few other diseases are being prescribed gabapentin and Lyrica. These are probably, gabapentin is the 15th most prescribed drug, but those are something that we've heard about. Most of us have heard about antidepressants. Most of us have heard about serotonin, opioids. About 85% of us have heard about cannabinoids. We've heard about these things. A few of us have heard about other things like capsaicin, which is what makes peppers hot, but capsaicin has been used in some cases against central pain syndrome. It's rarely used anymore. How many people take certain drugs? And this is the most interesting thing. We found that 6 out of 10, 2/3 of us, take anticonvulsants. That would be gabapentin, Lyrica, lamotrigine, or carbamazepine, which is an older drug, seldom used, but some began taking it a number of years ago, and they still take it. But 2/3 of us take mostly gabapentin and Lyrica. This is the primary drug being used for central pain syndrome now. The reason this is important is because in the protocols, things like nortriptyline and amitriptyline are still listed as first protocol drugs, and they should not be, because people who are depressed and have other issues with central pain syndrome, these tricyclic antidepressants can have a negative effect rather than positive. And so I think as people who know, 2/3 of us are using epileptic drugs like gabapentin and Lyrica. That's the first thing that should be used. Then a large number of using antidepressants, still about 1/3. Next would be opioids. About 38%, or 4 out of 10, are actually using some kind of pain medication for central pain syndrome. You'll find a lot of places, because of the crisis we had with opioids, that we are warned against using them for neuropathic pain. But in fact, when nothing else works, people are finding that opioids actually help. And then 1/3 of us also use cannabinoids. So we use cannabis or marijuana-based pain medications or medications, whether they're edible or inhalable. Some people smoke the stuff, but people are using this. 1/3 of us are using it for central pain syndrome. Steve Abrimsky asks, have ketamine infusions helped anyone? Yes, Steve, ketamine infusions have helped. It looks to me, though, only about 1 out of 4 or 5, maybe 2 out of 5. So we have stories of people that have taken a ketamine infusion, but most of the stories are that they took it and it didn't help. However, in about 2 or 3 stories out of 5, maybe 30 or 40%, I want to say, right off the top of my head, we don't have a statistic on this, but it has helped some. Now, it's helped more people with depression than with central pain syndrome, and so it's been used for depression. What you have to watch out for is the fact that things like ketamine infusion are blooming. They're going from 60 or 70 or 80 pain clinics to 1 to 200 pain clinics where they don't know how to do the treatment as well. So with things like ketamine infusion and stem cell treatment, we have to be extremely careful with who we choose to do the treatment. But these are some of the things. So anti-epileptic drugs are the number one drug. 60% of us use them. About 1/3 of us use opioids, and about 1/3 of us use cannabinoids. About 1/3 of us use muscle relaxers. If you asked 100 people, these are the 4 drugs that you would find that people use. They use anticonvulsants, they use opioids, cannabinoids, those are pain drugs, and they use muscle relaxers. And there are other things like supplements. How did you hear about the drug treatments? Most of us, about 90% of us, heard about the drug treatments we're using from our doctor. About half of us heard about different drug treatments over the internet. So we looked and saw what others on our CPS site were using, or we looked and saw what others were doing from other groups. You know, it's 10 minutes till, and I've been talking for an hour. I want to get to where next time I'm hoping that someone like Kelsey, who is helping with a lot of our things, can talk with me, and we'll try to make it so that instead of one person sort of talking, we'll have some interaction. But Mark Miller says, does alcohol work? Well, alcohol, like so many other things we might use it for, has both good and bad effects. So I know people have used alcohol and it's helped their sleep, which has helped them with central pain syndrome. I know folks who have used some alcohol and have found some pain reduction, and that has also helped. Then, of course, we have all the negative side effects like hangovers that we have to look out for. So, Mark, the answer is yes, but we have to be careful with how we use it. In fact, I'm going to have myself, this shouldn't be publicized, but it's Friday. I'm going to be off work after this, and I may have a nice, a little can of some bubbly that will help me to relax. We're almost out of time, and I'm going to just give a few more things. Let me just give you a few more questions we're on question 30. This is invasive treatments. I want to talk about this. Things like spinal cord stimulation, motor cortex stimulation, or dorsal reentry. There's deep brain stimulation. Let me just finish. With deep brain stimulation, what actually happens is you can see I have a scar right here, right? From brain surgery. Deep brain stimulation, they actually open the skull, craniotomy, they drill a small hole, they put an electrode into our brain, and they put the electrodes that it hits a very specific part of the brain where they believe the damage is in. So, for example, deep brain stimulation is being used for Parkinson's, and they can actually go in. The globus pallidus is what deteriorates under Parkinson's. They're actually able to put the deep brain stimulation electrode into the brain, have it fire off, and this causes Parkinson's effects, particularly the movement, the inability to control movement, to be lessened, okay? So the question is, because some of the same parts of the brain are damaged under central pain syndrome, could we use things like deep brain stimulation? And here's what I want people to understand. Yes, there have been a few tests where deep brain stimulation was used specifically for a test on central pain syndrome. About half the time there was a positive effect, about half the time was a negative effect. And so that's why I say we need to be very careful. There have only been just a handful of people, 10 or 12 or maybe 20 or 30, who have done deep brain stimulation because it is a craniotomy where we have a result and where we can say, okay, this is something that was beneficial to folks with central pain syndrome. And so we'll talk about more of these things. We've gone through most of the survey. Some of the last questions in the survey are very interesting, like where are people in the world and how many are they? In the time that I have left, I just want to hit those things very quickly. We have found in our demographic studies, which I just went through again today, that there are about 20 million people around the world who have central pain syndrome. About half of them had strokes. We know, for example, of the millions of people who have strokes every year, I have the notes here for myself, that we see that during a year, there are about 80 million stroke survivors alive, which means somewhere between 8 and 10 million people in the world, just because they survive strokes, have central pain syndrome. About 500,000 people every year around the world will have some kind of serious spinal injury. Interestingly, this affects 70% men and only 30% women, the obvious reason being that many spinal cord injuries happen because of work or other dangerous activities where the spine is injured. And so there are about 3 million people in the world who have central pain syndrome due to the fact that their spines were injured, and that's a terrible thing. About 10 million people around the world suffer from Parkinson's disease. You know that Parkinson's causes unwanted motion and then quite a few other deleterious brain effects because of brain damage. In fact, I have brain damage from brain surgery that causes some of the similar effects to Parkinson's, and that's because the same part of my brain is injured. But out of 10 million people worldwide, about 3 million would have this burning pain over part of their body, which is a terrible thing. That's another 3 million. Multiple sclerosis, MS. There are about 2.3 million people around the world. 30% have central pain syndrome. And so that's 0.8 of a million people around the world with central pain syndrome because they had multiple sclerosis, which led to this terrible secondary burning. Even things like cancer, friends, 17 million people a year survive cancer, but about 2% of them, which is a good third of a million people a year, are finding that they have this neuropathic pain caused by a damage not to their peripheral nerves, not to the nerves at the end of their fingers, like my damaged fingers, but because their brain stem, or their spinal cord has been damaged somehow, leaving them with this mysterious pain. And so what we're learning is that there are certain things that are causing this vascular lesion. When we say stroke, we're talking about a lesion. That means basically a scab. Someplace on the brain, there's a scab. And if the scab is in the wrong place, what is known as the spinothalamo-parietal network. So spine is the spine. Thalamus is the thalamic part of the brain. Cortex is the front part, the part that's logical and does all the front thinking. But between this cortex, between the thalamus in the brain and the spine, the spinothalamital cortex network, any place that gets damaged, all kinds of bad things happen. Brain waves go out of whack. There's not enough inhibition or slowing down of the electricity going through this part of the brain. All these things begin to happen sort of physiologically, and it causes the person who is struck with this damage in their brain to experience the burning pain over their skin and even deep within their body. I might say that, just so you know, and this is a terrible thing, but 25% of those of us who experience this terrible pain, especially in the upper levels, experience suicidal ideation. And I think this is an important thing to understand. During the Civil War, when this disease was discovered, because they were able to use antiseptic and keep people alive, people got hit with bullets in the head, they were able to keep them alive. And then they found that they had this burning pain. And they discovered that it was damage in the brain a lot of the time that caused it. And they also found that the pain was so terrible that men were trying to kill themselves And we now know that it's about 1 in 4 of us have pain so bad that it causes this. Most of the time in the brain, it's a stroke, but a lot of times it's a penetrating trauma, or it's a trauma that happens outside. Even with things exploding outside the head, this causes a traumatic brain injury. There's brain injury inside, and there ends up being this kind of central pain that we have. And so we're talking about these things. Inflammation, and this is where MS and primary Sjogren's syndrome and things like fibromyalgia and others can cause inflammation in the central nervous system. And it's inflammation even at the cell level, where even in our cells, we're having cell damage and the cells themselves are inflamed. And so in the nervous system, there's inflammation. Things are growing, and liquid water is actually going there and causing inflammation. We believe that we're under attack, and so our immune systems sometimes go after the central nervous system and cause inflammation, which ends up causing this central pain syndrome because of that damage. There are things like infections, abscesses, guma, tuberculoma, encephalitis that cause. Now, next time I'll be talking more about the causes, but we have found that there are 71 different causes. This is documented with clinical research, but everything from spinal inflammation to just the most basic kind of damage in the brain. There have been cases where people 10 years old, sadly, with HIV, because the HIV caused inflammation in the brain, they began to have central pain syndrome. Fortunately, when the HIV symptoms were brought down, the inflammation was brought down, then also the central pain syndrome went down. But that tells us that inflammation and infection can cause this terrible disease, sometimes for a lifetime. Tumors in the brain also are something that cause central pain syndrome to happen. In the spine, there's spinal trauma, where the spine is fractured, or where the spine is even broken, or where there's cordotomy, the spine's actually torn, and Schneider's syndrome, it's called, where there's concussion to the spine. All of these things can cause such damage that they end up causing central pain syndrome later. If there's a hemorrhage or some kind of blood leakage around the spine, this can cause damage as well. There's rheumatological and degenerative disorders that cause damage not to the brain, but to the spine. And so the same sorts of things that cause damage in the spine, inflammation and rheumatoiditis, and all these things all along the spinal cord and the brainstem can cause the same kinds of things. I could talk about this, and we could talk about this with your questions. Hi, Elena. Good to see that you tuned in. What we want to do is establish a month-by-month, 1-hour recording of the main issues that central pain syndrome people face. What causes it? When do we get it? Why do we have it? There are surveys that you can look at. They're in the file folder at the Central Pain Syndrome Facebook group. You can see the answers yourself in 2019 and 2020. Later today or tomorrow, I'll be posting again the 3rd annual survey. What we want to do is follow over the years. Are people using more of this kind of drug? Are people using less of that kind of drug? Are people having different kinds of surgeries or things that help them? Are more people getting CPS or fewer people? We're tracking these things year by year. So I encourage you to take the survey. And month by month, we'll get together. Next time, I hope to do an interview, probably with Kelsey, if I can get her, but with someone who has CPS, just so we can have 2 folks talking. But we're going to have a month by month, 1-hour talking where you can find out by listening, if you prefer that, rather than reading all about central pain syndrome. It's been a good hour. I've had a lot of friends, folks who knew me in my previous career as a public speaker, and folks who know me now just trying to help those with central pain syndrome. I'm very glad to see you, and I want to welcome everyone and thank you for tuning in a little bit. It's been a very good hour. We've talked about the survey that we took over the last 2 years. Why do people have central pain syndrome? How do they discover it? What kind of medication are they taking? What kind of treatments are working? And we'll continue to pursue these sorts of things. There's a foundation that's happening. It's a small group of people who care enough to go beyond the Facebook group. We're raising money. We're looking at research. We're doing all the things that foundations do that are trying to help folks with a particular illness. And so with that, I would like to say goodbye It's been our second hour, January of 2021, with the Central Pain Syndrome live stream. And it's been really a good time. And we'll talk to you again in a month. Let's keep in touch until then. All right. I don't know how to finish, but I think I'll press a button and say, bye now, everybody. Good to have you with us today.